You wake up in the morning, you sit on the edge of the bed, and before you even put your foot on the floor, you already feel that first sharp jab in your knee. You stand up slowly, carefully, holding on to the furniture next to you. The first staircase of the day is a painful negotiation with your own body. You go down one step at a time, gripping the railing, hearing the crack. That Sunday barbecue at your son's place. You went, but you stayed seated the whole time, because getting up and bending down to play with your grandchild has become impossible. The walk your doctor told you to take, you did it the first month, then quit, because the pain afterward was worse than the benefit. And then came the line you've heard from at least 3 different doctors, said almost without making eye contact. It's age, ma'am. It's just the natural wear of cartilage. If you're over 60 and this scene feels familiar, stick with me for the next few minutes. Because what I'm about to tell you might be the most important thing you hear this month about your joints. And the solution is simpler and built on solid science that nobody has shared with you. I'm Dr. Kevin Vries. Over more than 15 years caring for patients over 60 with joint pain, I've seen the same story repeat thousands of times in my office. Patients who've been taking diclofenac for 5-10 years, and their stomach can't take it anymore. Patients who do physical therapy religiously twice a week, strengthen their quadriceps, but the pain inside stays the same. Patients who've already had 2-3 cortisone injections in the knee. Relief lasts 3 months, then comes back. Patients on the waiting list for a joint replacement, waiting for a surgery with huge risks at their age. And the worst part is that most of these people are doing everything without correcting the root cause. There's a specific protein that rebuilds the matrix of your cartilage, with more than 50 clinical studies backing the effect. And very few doctors in a 5-minute appointment have time to explain it. Today, I'm going to. The technical name for what's happening in your knee is osteoarthritis, or OA. And here's the figure that might surprise you. Studies published in journals like The Lancet and Osteoarthritis and Cartilage estimate that more than 70% of people over 65 have some level of osteoarthritis in their knees, hips, or hands. It's not a rare disease for a few unlucky ones. It's a process that affects the absolute majority of people who reach this age range. And the reason is chemical, not mystical. Your cartilage is essentially made of a protein called type 2 collagen, along with proteoglycans and hyaluronic acid, organized like a spring mattress that absorbs impact. As we age, 3 things happen at the same time. First, your natural collagen production drops about 1 to 1.5% per year, starting at 25. Do the math. By 60, you produce nearly half the collagen you produced at 30. Second, cartilage turnover slows down. Old tissue isn't replaced at the same speed. And third, constant microinflammation in the joints corrodes the matrix that's left. When the spring mattress loses its structure, the bone on top starts rubbing against the bone below. Then comes the pain. Then comes the cracking. Then comes the morning stiffness that takes 20 minutes to fade. So what does most people do when they start feeling it? They go to their family doctor, describe the pain, and walk out with a prescription for an anti-inflammatory. Diclofenac, ibuprofen, naproxen, nimesulide. Always one of those. These drugs work to mask the pain, but they do absolutely nothing to rebuild cartilage. On the contrary, chronic use of these anti-inflammatories destroys the stomach lining, overloads the kidneys, raises cardiovascular risk in older adults, and in some studies, actually accelerates cartilage wear long-term. People who don't go the anti-inflammatory route go for the cortisone injection. It works, relief in 3 days, but in 3 months the pain comes back. And every injection in the knee weakens the tissue a little more. So after 4 or 5, even the orthopedist warns against more. To round it out, there's physical therapy. Look, PT is gold. I send every patient to it. But here's the catch. PT strengthens the muscles around the joint, which takes load off the knee and reduces pain. But it doesn't supply the cartilage with the raw material it's missing. It's like building a scaffold around a wall that's collapsing. The scaffold helps hold things up, but the wall keeps falling apart inside. And the biggest mistake, the one I hear most, and the one that hurts me most to hear, is the line, "Doctor, but cartilage doesn't regenerate, right?" Wrong, wrong, wrong. Cartilage does regenerate. Slowly, but it regenerates. What it needs is the right raw material in the right dose every single day for months. Without raw material, anything you do on top is palliative. Here's a detail that almost nobody picks up on. Type 2 collagen makes up about 90% of the protein matrix of your cartilage. It's practically the entire structure. And for a long time, medicine thought taking collagen by mouth was useless because the stomach digests the protein into individual amino acids, and the body decides afterward where to send them. Picture it this way. Imagine you need to repair the cartilage in your knee like it's a broken brick wall. As you dump bags of cement, sand, and lime in random order at the construction site, the bricklayer has to sort through everything, sift it, and then decide how much goes to each wall in the house. Most of the material ends up going to other walls: skin, hair, nails, bones, and very little reaches the knee. That was the problem with old collagen in coarse powder or regular capsule. But science has moved on. Today, there's hydrolyzed collagen in low molecular weight peptides, below 5 kilodaltons. They're pre-cut pieces, small enough to cross the intestinal wall without being fully digested. Stick with me here, because this is where it gets interesting. In 2005, a German team led by Oesser used collagen tagged with radioactive isotope to track where the peptides went after ingestion. Result? 12 to 24 hours after the dose, the peptides accumulated preferentially in articular cartilage at much higher concentration than in any other tissue, meaning the body recognizes these specific peptides as cartilage raw material and prioritizes their delivery there. It's not faith, it's not placebo, it's preferential distribution proven with isotope. And more, these peptides don't just become bricks, they also activate the chondrocytes, which are the cells that manufacture new cartilage. In vitro studies show that specific peptides like prolyl hydroxyproline signal the chondrocyte to produce more collagen from scratch. Meaning, you're not just refilling, you're waking up the factory. Now comes the part that matters: how to actually fix this. And here's the first important point. Not just any collagen will do. There's type 1 collagen, the most common on the market, and excellent for skin, hair, and nails. There's type 3 collagen, which appears mixed into some products. And there's type 2 collagen, which is the one specific to cartilage. When the goal is knee, hip, hand, or spine, you specifically want hydrolyzed type 2 collagen, or a product with type 1 and type 2 combined. Within type 2, there are still two categories. The first is hydrolyzed type 2 collagen powder, generally sold in 10-gram daily doses. It's cheaper, has the backing of many studies, and works well as both raw material and signaling agent. The second category, newer and fascinating, is UC2, or undenatured type 2 collagen. That one acts through a completely different mechanism. In a tiny dose of 40 milligrams a day, it teaches the gut's immune system to stop attacking cartilage cells by mistake, in a process called oral tolerance. Studies like Lugo's, published in 2016 in Nutrition Journal, showed that 40 milligrams of UC2 daily was more effective at reducing joint pain than 1,500 milligrams of glucosamine plus 1,200 of chondroitin after 90 and 180 days. Both work. The hydrolyzed powder gives abundant raw material and has a broader effect. UC2 calibrates the immune system and uses a small dose. For many people, combining the two is ideal. But if you want to start simple, with good cost-benefit and clear mechanism, hydrolyzed type 2 collagen powder is the safest first choice. Before I explain exactly how to take it, do me a quick favor. If this video is helping you understand something nobody explained well to you before, click the subscribe button down below. That's what lets me keep bringing serious, science-based information without pushing things that don't work. Subscribing is free, and it helps me a ton to reach more people who need to hear this. You can rewind the video now, because what's coming next is the practical part, with the right dose and the right way to take it to see results. Let's get to practice. The recommended dose of hydrolyzed collagen peptides for an adult over 60 with joint pain is 10 grams of peptides per day, every day, without missing. Pay attention to that word, peptides. Read the label carefully. Some brands sell collagen powder, but it's the whole protein, not hydrolyzed. Your body will benefit much less. Look on the label for the words collagen peptides, hydrolyzed collagen, and ideally an indication of low molecular weight, below 5 kDa. The powder has no flavor and doesn't thicken, so you can mix it into almost anything. I usually direct my patients to take a single 10-gram dose in the morning, dissolved in half a glass of water, or mixed into coffee. Careful, into warm coffee, not boiling. Above 60 degrees Celsius, you start denaturing some of the peptides, so let the coffee cool for 2 or 3 minutes before adding the powder. You can mix it into juice, yogurt, smoothie, whatever's easiest for you to take every single day. And here's a detail that changes everything. Take it with vitamin C. That can be an orange, a squeezed lemon, a fresh acerola juice, or a vitamin C tablet of 500 to 1,000 milligrams. Vitamin C is a mandatory cofactor for your body to make new collagen out of these peptides. Without vitamin C, part of the material you took simply doesn't get assembled into cartilage. I had a patient, a 67-year-old gentleman I treated, a retired teacher, with knee pain for almost 8 years. He was already on the list for joint replacement, the orthopedist saying it was a one-way surgery. He resisted, came to my office, started with 10 grams of hydrolyzed type 2 collagen in the morning with vitamin C, plus a light walk of 30 minutes a day. In the first 6 weeks, he called me discouraged. "Doctor, I'm not feeling any difference." I asked him to keep going. By week 12, he climbed the first flight of stairs without holding the railing. By 4 months, he was back to walking an hour without pain. He came off the surgery list. I see this often in my practice. The effect isn't magical, isn't instant. Cartilage is slow tissue. You'll feel some difference starting around week 8. The full effect comes between 3 and 6 months, when the chondrocytes have rebuilt the damaged matrix. You have to be patient, and you have to do it every day, no skipping. And to amplify the effect, there's what I call the multiplier trio. Hydrolyzed type 2 collagen on its own already works very well. But if you want the full result, add 2 specific allies. First ally, vitamin C, around 1,000 milligrams a day, split into 2 doses. I already mentioned it's a cofactor for collagen synthesis, but it does more. It's also an antioxidant in the joint, neutralizing free radicals that destroy the cartilage matrix in parallel. Second ally, MSM, short for methylsulfonylmethane, which is an organic form of sulfur, at 1 to 3 grams per day. Sulfur is the element that makes the cross-links between collagen fibers, giving both stiffness and elasticity at once. Without enough sulfur, the collagen you produce stays loose and brittle. And MSM has a bonus. Studies show a direct anti-inflammatory effect in the joint, reducing pain while cartilage rebuilds. And here's the third optional ally that many forget. Vitamin D3, around 2,000 international units a day. Vitamin D regulates joint inflammation and the health of subchondral bone, the bone right beneath the cartilage. When that bone weakens, it transmits more impact to the cartilage and accelerates wear. And here's the bonus nobody tells you. When you correct the health of your cartilage matrix, you don't just improve the knee, you also improve the spine because intervertebral discs are made of type 2 collagen. Reduce hand and wrist pain in those with hand arthritis. Improve skin, hair, nails because the synthesis byproducts go to those tissues too. And slightly increase bone density in long-term studies. It's not one thing, it's a system. It's not Y, it's X. It's not a supplement for the knee. It's the missing raw material in your entire connective tissue machinery, and correcting it has a positive domino effect. Now some important warnings, because I take responsibility when I'm talking to you. Hydrolyzed type 2 collagen is an extremely safe supplement for the vast majority of people. But there are 3 situations where you need to be careful. First, fish allergy. There are 2 source types of type 2 collagen on the market, bovine and marine. If you're allergic to shellfish or fish, choose bovine source type 2 collagen and verify on the label. Second, chronic kidney disease at advanced stage. Collagen is protein, and someone in stage 4 or 5 kidney failure needs to control protein intake very tightly. Don't take it on your own. Talk to your nephrologist first. Third, pregnancy and breastfeeding. There aren't enough studies, so the safest is not to use high supplementation in this period. For everyone else, start at the standard 10-gram dose. Observe your body for 2 weeks. Don't expect a miracle in a week. I'll repeat because it's important. Cartilage takes a minimum of 2 to 3 months to show clear improvement, and 6 months for full result. I left a link in the description below to a hydrolyzed type 2 collagen powder I personally recommend, with low molecular weight, no unnecessary additives, good cost per dose. If you'd like to take a look, just click below the video. But the most important thing isn't the specific brand. It's starting and being consistent. Look, I wanted to close this video by telling you something important. A joint isn't a young person's luxury. A joint is the foundation of your autonomy. It's what lets you climb stairs without help, get up off the toilet alone, leave the house, walk with your spouse, bend down to play with your grandchild, drive, dance at your kid's birthday. When the knee hurts, you start avoiding. And when you avoid, the muscle atrophies, balance gets worse, fall risk skyrockets, and sadness creeps in. Forced sedentary behavior from pain is one of the invisible reasons many people over 70 slide into depression. It's not emotional weakness, it's a direct consequence of losing mobility. And the worst part is the resigned look I see in many patients at their first appointment. "Doctor, it's my age, it's the wear, that's just how it is." It isn't. Knee pain at 65 isn't destiny. It's a deficiency of raw material and an excess of inflammation, and both are correctable. Hydrolyzed type 2 collagen is one of the most underused tools in medicine today for restoring joints in people over 60. If this video opened your eyes, do 3 things for me. First, tell me down in the comments which joint bothers you the most: knee, hip, spine, hand, and for how long. I read every comment, and it helps me make more videos about what you actually need. Second, if you're not subscribed to the channel yet, click that red button down below. Third, send this video to someone in your family or a friend you know has been suffering with knee pain for years. It might be the most useful thing you do for that person all week. I'm Dr. Kevin Vries, and as I always say at the end of every video, take good care of yourself.